Assalamu alaikum and welcome to Medicower. I'm your host for today, Rabina Mia. Today's subject is very much around talking to our regular doctor, Dr. Liz, and in our studio we've also got a new guest today who's a patient who is a diabetic. So what we want to do is look at how that relationship between a doctor and a patient works when somebody's got a condition like diabetes. So welcome, Liz, to the show again. It's lovely to see you here.
And thank you. Nice to be back.
And welcome to Daphne, who's a teacher by profession and has been a diabetic for some time.
Yes.
So hopefully we're going to ask you a little bit more about that. But before we do, if you don't mind, I'm going to ask Liz, can you tell me a little bit about diabetes and why it's such an important aspect of health that you need to monitor it regularly?
Right, gosh, that's a good question, because we could spend a long time answering that. I think what we should do is there'll be a lot of people watching today who probably don't really know a great deal about diabetes. So perhaps we just ought to explain that our body needs to have a healthy amount of glucose or sugar in our bloodstream because we need energy. So we need energy for our muscles to work, but we also need energy for our brains to work and for our hearts to work. So we need the right amount because if we have too much blood glucose or the blood sugar is too high, it can actually cause damage. We use a hormone called insulin that's made inside our body from the pancreas gland, and the insulin is rather like a key that opens the door so that the sugar in our blood can move out from the blood into the part of our body that needs the energy.
And I think in the past we've really made a distinction between people understanding we're not talking about sugar that we put in our tea. This is a different type of sugar.
We should really say glucose. Glucose is the proper term, but so many people don't quite understand what glucose is and find it a bit confusing. So we should almost use the two words together. If we were being medical, I think we'd just say glucose, but you know what we're getting at, really. So we need the right amount of insulin in our bodies, and the trouble is some people, they cannot make enough insulin. Very often that could be, for instance, in a young child who has a pancreas that isn't working properly, so they can't make any insulin, and that would be what we call a type 1 person with diabetes. So they will need to have insulin injections. But we also have other people, for instance our friend Daphne, who's what's called a type 2 person with diabetes. And for somebody like Daphne, and I'm not necessarily talking about Daphne, I'm talking about other patients with type 2 diabetes. It may be, for instance, a much older person, so obviously not you, Daphne, somebody who's very old with grey hair, who's perhaps 95, and they have a pancreas that's old. So just as on the outside we've got grey hairs and wrinkles, on the inside we've got a pancreas that's old that cannot make enough insulin, and therefore there isn't enough insulin to control the blood glucose. But the other patient we see a lot of now are people not as old as our old person with grey hair, but somebody who is getting older but probably is overweight and tends to have a lot more fat in their body than we would normally recommend, and particularly fat round the middle. And this fat stops any insulin that your body is making from working properly. It's almost like it's a brick wall and it stops the insulin getting through.
So it's not that it's not there, it's just not, the body isn't working as well as it should do.
That's right. So often we have a combination. People are getting a bit older and their pancreases aren't able to make as much insulin, but also this less insulin than we really want can't get through to where we need it to work. So it's a bit like you could have a car which you're only getting 20 miles per gallon out of the petrol instead of getting 30 miles per gallon. It isn't all getting through. And also the tank's half empty because we haven't got enough insulin produced anyway.
That's really helpful to hear that, Liz.
So perhaps if people understand that now, we can talk about what the dangers are or the problems and the complications can be if people have too much blood glucose. And although most people living with their diabetes will feel absolutely fine, it's very tricky. It's going on in the background, so people don't even know there's any problems going on. And in fact, Rubina, probably by the time most people are diagnosed as having diabetes, some of the complications are already starting to show.
Because what I've heard is that people who have diabetes can often take longer to heal if they've got a bruise or a cut or a wound of some sort. Is that true?
In certain circumstances it can be, but you're talking about cuts and wounds.
Yeah.
Patients with diabetes are more at risk of getting infection in those cuts or wounds, which of course will slow down the healing process. And if you think about it, what you've got is, if there's more sugar, glucose in the system, that's great for all the germs and the bugs. They're going to love that. So if they can get in through a hole in the skin, we've cut the skin, we've got an ulcer or something, for instance, the germs can get in and they can then cause an infection, which will obviously delay the healing of the wound or the cut.
Sure. Okay.
But the complications of diabetes can be very serious. So, for instance,
we're going to talk about some of those with Daphne as well, aren't we? Sorry, did you want to finish?
Well, I was just going to say we could start. I mean, and Daphne, we are going to talk about some of these, aren't we?
Yeah.
But I'm presuming, Daphne, every year you go and have your eyes checked.
I do. Yes.
And do you know why you have to go and have your eyes checked?
Yeah, it's because of retinopathy. Well, there's two reasons really. The first thing is to check that my eyes are still fit to drive. When you go for your yearly eye test, they just say, oh, we'll just read the letters on this chart.
Yeah.
And the first year I just went, oh yeah, that's fine. And then after I'd done the test and passed it, she said, oh well, because if you couldn't read that line, you wouldn't be fit to drive. And I was kind of, oh no, my goodness.
They didn't tell you that in advance, which is
No.
probably, yeah, we need to be safe, don't we?
Yes, and I totally agree that
agree,
you cannot have people with poor eyesight going around driving, but because diabetes can cause eye problems, the first thing they check is if you're a driver, whether you're fit to drive. And then the next thing is they scan your retinas. It's a very simple test. It's not difficult. You just sit there and they blow stuff at your eyes and they take photographs, and it's very easy. They check the pressure in your eyes to check that's all right, and then they take photographs of your retinas. You just put your chin on a thing and they go click it.
Yeah.
And
So they're looking into the back of your eye to see
yes.
whether the blood vessels are working okay.
The retina is like the sort of inside surface of the eye.
Okay.
So if we had a box in front of us and
Yes.
we opened the box,
Yes.
then the lining of the box, the inside, is classed, if it was your eye, as the retina.
I see.
So if you damage the retina, that's when you can have serious problems with your eyes.
Okay. And it could be just one eye, or it would always be both?
No, it can be either or
Okay.
both.
All right.
And it's something that's always worried me because my eyesight has never been good. I was born with very poor eyesight, and therefore I'm worried about losing it more.
Yeah.
So every year they say, oh no, you haven't got retinopathy, which is great. This last couple of years, one person said, oh, you might have a bit of background retinopathy, and then the other person looked at it and went, no, you haven't. So
Okay.
I'm sort of a little bit on the edge,
Okay.
but it is something that worries me because I've always been worried about my
And
sight.
I think, Daphne, you're absolutely right. If there are any definite signs of a problem starting, there is treatment that can be very helpful.
Yes.
People have possibly heard of laser treatment, and that laser treatment can actually make a huge difference, because if we look at the commonest cause of blindness in people of working ages in the UK, it is actually diabetes.
Oh, is it? That's quite
So
serious
that's
then.
how important and how serious the complication of eyes can be with diabetes unless they are checked regularly, hence having it done every year, so we can be on the ball the minute anything goes wrong.
And one thing that I've noticed when I go for those yearly eye checks, people worry about going for eye checks partly because they think, oh, it'll take all day. It really doesn't. I've always gone in at exactly my appointment time or even before, and often I'm out by the time of my appointment because it doesn't take very long. The man who does it is great.
Woman.
Oh, well, yes, the man, but it happens to be a man who does mine, and he knows me, and I see him every year. I've found it's such a simple procedure. It doesn't hurt. It's just well worth having
Am I
done.
right in thinking that you can't drive after it though because of something that they use to make the blurry eyes a
they
little
put
bit?
drops in your eyes, and actually, I remember the first time I had these drops in my eyes, it made me feel really faint, and I thought, oh no, that's really odd. And I was really worried the next year, and the next year I'd kind of got used to them and I was fine, and I've been fine ever since.
Those drops are actually to open up the pupil, which is really the hole that you're looking through. So it's obviously a lot easier to look through a big hole to the back of the eye than to look through a tiny hole. But that means that you can't always focus as well. So if you're going to get into your car and drive home afterwards,
can't drive home.
Your vision wouldn't be
So
be
you
as
need
good.
to take somebody with you, get the bus or something.
Yes, exactly.
I really want to come and talk to you, Daphne, a little bit about your history of being somebody that's had diabetes for a long time, I think. When did you actually find out, or what led to you finding out?
Well, my father had diabetes type 2, and it does tend to run in families, though he was diagnosed very late. So well before he was diagnosed, I sort of had the symptoms. I asked to be checked for it when I was in my 20s because I knew a little bit about it. I've always been thirstier than everybody else all the time, which means I've always gone to the loo more than everybody else. So there's that. And then as my 20s and 30s went on, I was checked in my 20s and they said, oh no, you're not quite in the range. Then they moved the ranges. So I think I was diagnosed in my early 40s, and I kind of, I was just sort of over the border into diabetes when I was diagnosed. And I suppose the symptom that really made me go and get checked out was tiredness. And I thought it was normal for me. So I remember,
you were working and busy anyway?
Yeah, I was always very busy. I've always worked. I've never not worked. But even on holiday, I would have breakfast, probably a breakfast that was larger than usual because I was on holiday, and then I'd go down to the beach and fall asleep, which was ridiculous. I thought, I'm losing half my holiday.
Most people would do that.
It's not for me, though. For me, I'd normally go in the sea. And I remember there was one holiday where my mum, I was driving back, and Mum wanted to stay till after lunch. We were in 2 cars for some reason, and Mum was in the car with me. She said, oh, let's just stay and go after lunch. Well, I had this lunch, and I thought, I can't drive. I'm falling asleep. And everyone was saying, you must be, just keep yourself awake. And I was kind of, I really had to really stick out and say, I can't drive till I've had a sleep, which I just thought, this is ridiculous. And then I went to the GP and got tested. And so that was when they said that I was diabetic. And to be honest, it was a bit of a relief because I'd suspected it for a long time, but it just gradually got worse. As to why I've got it, for me, and Liz may be able to contribute to this, I always have craved carbohydrate in any form, you know, be it sugar, potatoes, pasta, rice, I want it. My son, who is thin as anything, doesn't have that craving. My father very much did. My mother, of course, was brought up during the Second World War, and therefore, for her, she couldn't have sugar because there just wasn't much sugar available. So as when she had a daughter, she was kind of, I can give this child all the sugar. And I was just, yes, give me all the sugar. And my grandma used to make sponge puddings and semolina puddings and all of those, and I just loved them. I would still love them. I try not to eat them, but I would still love them. So that, I don't know if that craving for carbohydrate and that sweet tooth goes along with the tendency to diabetes, or whether it's just incidental. I don't know. I don't know what you think, Liz.
I'm not sure I would say that the craving is what pushes you into diabetes, but I would say because you are eating a lot of carbohydrate, you therefore will be having a lot of glucose in your bloodstream when your food is digested, which will demand that your pancreas makes plenty of insulin to control the blood glucose. So your pancreas is working hard a lot of the time, perhaps more than you mentioned your son, who doesn't eat as much. And also by eating all those foods, there's a far bigger tendency for you to be slightly overweight and have a bit more fat round your middle.
And
so
and I am that typical, you said, the fat round the middle shape. My legs, because I've done a lot of swimming and walking, are actually quite slim. all my fat is here.
Yeah.
It's just the worst place for it to be.
It's just
But
the way
that's
it
where
goes
it
for
is.
some people, doesn't it?
Absolutely.
Yeah.
So tell me, Liz, what's the difference between a type 1 diabetic and somebody who's got type 2 diabetes?
Well, do you remember we mentioned earlier about it can be when your pancreas is just not able to make any insulin at all. So we tend to find people with type 1 diabetes are diagnosed when they're very young. So it's often children, can be very young children, you know, as young as 3 and 4, 5 and 6, or perhaps slightly older in their teens. And we're not always sure why. Very likely it's some infection which has affected the pancreas and damaged it so that it is not able to make insulin. So the rest of the pancreas can work really well, but the particular part of the pancreas that would make insulin is completely not for 6. So that person has to have insulin, and the only way at the moment we can provide insulin is via injections. So they are insulin dependent. They need to have insulin injections every day. Somebody with type 2 diabetes, as we mentioned for Daphne, one of the reasons is the pancreas gland is old and can't make as much insulin. It's tired, it just can't produce as much. And secondly, if there's rather a lot of fat round the middle, we actually call that insulin resistance. So the fat causes a resistance to the insulin. The insulin can't get through. So people with type 2 diabetes can look after their diabetes by trying to lose weight. They're watching carefully the food they eat, which will often help them to lose weight, by taking plenty of exercise and being physically active. I mean, exercise isn't always joining a gym and running a marathon. Being physically active is
telling me a lot more about what she does.
digging the garden or going to a Zumba class or, you know, walking upstairs instead of using a lift. It's all those things. So that way, absolutely. It's that way of using up more of your blood glucose. We have tablets which can be very helpful. I think Daphne can probably tell us about different tablets she's tried in the future. So we have different tablets which can be used on their own or in combination. But there may come a time for some patients with type 2 diabetes where they've tried all the tablets may well have been very successful at one point, but we get to a stage where the tablets aren't doing as much good as we need, and we therefore have to help them by giving them insulin as well.
And I think that's where your health has changed, hasn't it?
Yeah.
Your treatment has changed, Daphne, because you did have and do have type 2 diabetes, and you were on tablets, but then you've had to become somebody that uses insulin as well. So how was that for you as a patient? I mean, was that a worrying thing for you? Was it something that you were really unhappy about?
No, to be honest, it was a relief.
Was it? Okay.
Because, well, first of all, when I was diagnosed, I did try diet and exercise. Part of the problem was, although I've always eaten too much carbohydrate, I had always exercised a lot.
Well, I know that about you.
I've
You're
always
a big
swum
swimmer,
and I've always
you?
walked, and I do like exercise. And for me, it was quite hard to just do it with diet and exercise, and it wasn't working. And in the end, it went, I mean, for example, there were very few areas where I could make easy changes. I used to drink alcohol very occasionally, and I just stopped drinking completely, and now I don't. So that was an easy change I could make, but there weren't many other easy changes.
Because you were already doing...
Because I was already doing... Because some people with diabetes hardly exercise at all. I've always exercised quite a lot. So after a while, that we realised with the doctor that was not working. So I tried metformin, which tends to be the first tablet that they give you. And some people can take it with no side effects at all, so please don't take anything I say as typical. But it made me feel queasy. And
that's sickly, isn't it?
Yeah, just sick. It was like having morning sickness all the time. It reminded me of when I was pregnant. And so they put me on the slow release metformin, which actually, for some people, takes away those sickness symptoms completely. But again, it didn't with me. I was on it for 2 years because actually metformin is a really good treatment, very safe, helps you to lose weight, which is great.
Actually, Daphne, I'll have to interrupt you there. I would actually say metformin doesn't help you to lose weight.
Really?
But it doesn't put weight on.
Oh, okay. When I started on it, everyone told me it helps you to lose weight.
Well, I think they were
Do you think they were just being
economical with the
right,
truth?
okay.
No.
Well, certainly I didn't put weight on while I
Okay,
was
well,
on
that's
it.
at least something, yeah.
Okay. So I was on it for 2 years, but it just, after 2 years, I just thought, I cannot cope with feeling sick all the time.
Yeah, I'm not
so
I'm amazed that you managed it for a couple of years.
Yeah, I was just quite
most
determined,
people,
really.
Most people can tolerate metformin.
Yes.
And you mentioned about feeling queasy. For some people, it's more their bowels feel bloated,
Right,
or
okay.
they want to go to the toilet a bit more.
Right.
Okay.
But most people, I would say 4 out of 5 people do manage metformin.
Yes, and I would really recommend it for
Yeah,
those who can. Then I tried another tablet called gliclazide, which works by lowering your blood glucose. And the problem with that was it gave me more energy. Well, this wasn't the problem. It gave me more energy than I'd ever had in my life. I couldn't believe it.
You know, Daphne, you said how when you before you were diagnosed with diabetes, you knew you were tired all the time.
Yeah.
That's because one of the symptoms of having a high blood glucose level is tiredness.
Yeah.
So
People
feeling
feel tired
very
for all sorts
Oh,
of reasons.
exactly.
Yes.
And we have to be careful.
Yeah.
I mean, when
Yeah.
you've worked hard, or you've been up working long hours, or
you've
you've
had
been
a
up
baby
during
or
the
something,
night,
yeah.
you will feel tired.
I thought it was
But-
because I was working hard, you know.
But it's interesting that Daphne recognised as soon as her blood glucose levels came down how much more energy she did
massive,
have.
yeah.
So sometimes it's sort of looking back later on that
Yeah.
you realise.
And I remember once I ran the whole length of Lidget Lane, which is where I live, and that's a mile. And I thought, I couldn't do that when I was 10. And there I was doing it at about the age of 50. And I was just astonished. But the problem with the problem with gliclazide was it gave me very sudden hypos, which we haven't talked about, but when your blood sugar suddenly goes too low.
Okay.
And I remember once being in London going, oh, well, I have to eat something now, because I was about to keel over. And after a while, that just got too much, really. And also, I was putting weight on with
gliclazide. The problem with gliclazide, a really fabulous tablet for bringing down blood glucose, which actually works by kicking the pancreas.
So
it
it
actually
does.
literally kicks it, so the pancreas says, oh, right, I'll make a bit more insulin. But the trouble is, if it's not used in the right doses, or if you're not eating anything to make sure your there is some glucose in your system, it can bring your blood glucose levels down too low, as you said, a hypo or a low blood glucose, and that can be a really horrible feeling.
So what happens when that happens?
Oh, it's so hard to describe. It is a really horrible feeling, and now I'm instantly aware of it. If some people can go all day without eating, and I've never been able to do that. I've always felt a bit hypo by lunchtime if I don't eat. You get a kind of brain fog. For me, one of the first things is I get really grumpy. And to me, hunger and anger are they're the same place in my brain. And one of my husband is lovely, and we've been married for nearly 37 years. But one of the first symptoms of a hypo is that I suddenly think he's an idiot.
Gosh!
He kind of, and everything he does is kind of, oh, Stephen, why are you being so annoying? And he says, Daphne, eat something. So you can often get grumpy. You get a kind of brain fog where you don't really think very clearly. So therefore, I don't always do the most sensible thing. You know, I need somebody there to say, Daphne, eat something, and then I eat something, and I'm fine in 10 minutes. But you also can get sort of a bit sweaty, a bit shivery.
Yes. I think, Daphne, it's very interesting. You explained how low blood glucose can do one of two things, or both at the same time. One is a physical symptom. So like you were saying about feeling sweaty or shaky. And then the other thing is more in your mind. You're confused. Some people will talk rubbish.
Yes.
And I'm going to have to hold you there because we're coming to our break, so we need to continue this conversation after that, because we do have to go for a break, and hopefully we'll continue the rest of that conversation. So apologies for interrupting you right there. Okay, everybody, inshallah, I hope you're finding it useful hearing about things from a patient's perspective as well as our doctor's perspective on diabetes today. Inshallah, we'll be back after the break. Assalamu alaikum.